تفضل دكتور شبل.
So shall we start?
Yes, please.
Okay. بسم الله الرحمن الرحيم. أهلا وسهلا الأصدقاء الأعزاء والزملاء والزميلات الأعزاء. So first of all, colleagues, I'm very pleased to be here today for this very important event, which is the launch of the monitoring framework for cervical cancer and the HPV in the Arab region. Of course, this is not a standalone initiative. This is part of the long journey that started 2 years ago with the first cervical cancer forum, then the second cervical cancer forum with the two Sharjah declaration, the first one and the second one from 2019 and 2021. So I think this is very important for us, this framework. As you know, cervical cancer is the most preventable cancer. And even if we can prevent it, we still have more than 7,600 deaths per year just in the MENA region. Of course, there are big disparities between the different countries, and that's why we say that it's better to focus on certain countries based on different criteria, the efforts that were made, but also the incidence. You know that the incidence rate is very high in 4 or 5 countries in the region, namely Morocco, Libya, Algeria, and UAE and Oman. But if we don't take action now, we will have even more deaths and more cervical cancers detected. And if we don't take action by 2040, sorry, we will have 42 women who will die from cervical cancer every day. So I think it's time to take action, and that's why we are here today. And I want to extend my gratitude and thanks to FOCP colleagues under the leadership of Dr. Sawsan Al-Madi, but also to our colleagues in the MNE unit in UNFPA ASRO, Dr. Adelakin, Dr. Faraj, and Nahla for their great work and support on developing this monitoring framework. I think it will be very useful for us, first, to track the progress that is made in terms of eliminating the cervical cancer and the HPV, in terms of investing in education, in the HPV vaccination or immunization, in terms of early detection, but also in terms of treatment till the palliative care. But on the other side, it will help us also to identify the gaps and how we can help, how we can leverage our technical, financial, and human resources to help these countries or these entities to invest more in the eradication or elimination of cervical cancer. So thank you very much for being with us today. And I hope that it will be a very informative meeting, and it will be the kickoff of a very good collaboration between our respective entities and agencies. I will stop here and I will hand it over. I will give the floor to our colleague, dear colleague, Dr. Sawsan. The floor is yours. Thank you, Dr. Sawsan.
Thank you, Dr. Shibel, and thank you very much for this warm welcome. And I am also very pleased and honored, actually, to be taking this, and as Friends of Cancer Patient, to be taking this step with the United Nations Population Fund, our partners since last year and even the year before, to be able to present a tangible and practical tool for not just nations, but also civil societies to be able to monitor the progress in their, of course, respected nation and respected countries. So what I'm going to do, I'm just going to take another 5 minutes from the dear participant time. I'm going to go through, remind myself and remind everybody about the Cervical Cancer Forum 1 and 2 and what are the outcomes. I'm going to speak a little bit about the timeline that we are looking for each dear participant, and of course I will present Dr. Faraj, who is the who will be leading the way into the framework and what it is, how it is, and how to use it. And of course, we'll open the floor for Q&A later on if anybody wants to ask Dr. Faraj about any technical detail. So next, please. So as everybody knows, Friends of Cancer Patient is a UAE-based organization. We are actually based in the Emirates of Sharjah. We have been launched under the patronage of Rehana Sheikh Jawahar since 1999. And we work on three pillars. We work on patient access, we work on community engagement and advocating and also advocacy, which is local and global. I'm not going to go through what we do at Friends of Cancer Patient. If anybody's interested to know, you can go into our website, www.focp.ae. But I'm going to jump directly to our first cervical cancer forum. Next, please. We have hosted the first cervical cancer forum in 2019 in January, in the month of cervical cancer awareness. And as an outcome for this one day, very high level meeting, which even some of you attended, we came up with something called the Sharjah Declaration 1 3x3. It was a pledge. Pledge was for civil societies and for also governments to be able to make sure that cervical cancer is no longer is a history. We need to commit to advocate work and establish and strengthening also the health service and empower individuals and community to be able to advocate to be able to eradicate cervical cancer. Now, next. In 2021, we hosted the second cervical cancer forum, and it was very interesting because we looked at all the entities who participated with us in 2019, and we had a really good two-day discussion. Unfortunately, it was virtual, unlike the first one, which was face-to-face. And we said that 2021, January was really a pivotal moment for us because we reflected back on the WHO elimination strategy that was launched in November 2020. And we said that really we need now to update our Sharjah Declaration. Next, please. Yes, this one. So we need to update our Sharjah Declaration. We called it the Sharjah Declaration 2.0, and we wanted to make sure that we are hand in hand and working parallel with the WHO elimination strategy, of course, with our partner, United Nations Population Fund. So the Sharjah Declaration 2.0 is focusing on four things: endorsement, investing, establishment of a South and South cooperation, and advocacy as well. And one of the for the Sharjah Declaration is to work on a monitoring framework to be able to monitor the development of the implementation of the strategy for the WHO, but also at the same time to empower and look at gaps that can be also filled and also supported for any nation who needs the support or any civil society that needs the support. Next. So this is what we have done as the timeline for the framework. We actually announced this framework as part of our commitment in the January 21 forum. Since Feb till 2021, we communicated the Sharjah Declaration with all our stakeholders. From April till July, we worked with the United Nations Population Fund with the core team, who are all amazing, and they are all here. Thank you very much for your hard work. We worked with them, and they did the hard work to be able to look at a framework to be able to utilize for the next 1 year. In August 2012, we finalized the framework, and we mapped the civil societies who are ready to to partner with us on this framework. In September, today, we are introducing the framework objective and reporting timeline, and hopefully in January 2023, we will welcome all of you to our third cervical cancer forum, where we will be discussing the data and outcome from the framework that you will help us accommodate and accumulate. Next, please. So for now, these are the month that we are hoping that all of us, we will work towards. After today, after the kickoff of today for the framework, we are hoping that phase one will be in November 2021, where we will start getting data from the respected countries and civil societies. We are hoping that in May 2022, we'll have another phase or another reporting for the data. And the last phase and last reporting for the data will be in October 2022. So we will be sharing these dates, these months with you, with the framework as well. So it is locked in your calendar, so you know that these are the months that we are looking for data to be submitted. So we're able to analyze these data and hopefully share an outcome in the inshallah third cervical cancer forum. Next, Majid. Thank you very much, and it gives me great pleasure now. I think all of us are looking forward to this. Dr. Faraj, for him to explain to us about the monitoring framework, and then we can open the floor for 10 minutes for Q&A. Dr. Faraj, please, the stage is yours. Majid, if you can help upload, please, the, yeah, thank you.
Thank you. Thank you very much for the introduction. Thank you very much for the introduction and for organizing this important event. Actually, building on what Dr. Sausan just mentioned, this framework is the accumulation of the two regional forums that the Sharjah or our partners in Sharjah have made to contribute in the global strategy, where the main indicators for the global indicators are 90, 70, 90. 90% of girls would be fully vaccinated, 70% of women are screened, and 90% of women identified with cervical disease receive treatment. As Dr. Sausan just mentioned, these are the four major commitments of the Sharjah Declaration. As you can see, the fourth declaration is about endorsing an establishment of a robust monitoring framework. And this is what we are presenting today. Actually, the monitoring framework consists of these three major levels. The goals, which is obviously the global strategy and the achievement of the indicators in the global strategy, while the outcome we're targeting here is the improved access to screening, vaccines, and treatment. In order to achieve this outcome, there are four major outputs: the advocacy, partnership, and South-South cooperation. The third is about data utilization. And the fourth is about the accountability for results. I would also encourage you to interrupt me if you would like to clarify or comment while I am presenting. Then the global or the overall goal is the achievement of the global strategy, which has these major indicators: the national and regional HPV vaccine implementation and cervical cancer incidence by type, age, and by stage, where the national regional cervical cancer survivors by type and stage, we have such indicators. And also we on the global level will monitor the national, regional mortality by cause, type, and sex. The frequency of the monitoring, originally it was biannual, but we have a more optimistic view, and it was suggested to also insert it on quarterly basis. So this would be an issue also to consider while we implement the monitoring system. Of course, the means of verifications would be the surveys, reports of the country offices, data collected by FOCB, GCC, the regional and national reports and data. So with the Sharjah initiative, obviously it will contribute in achievement of the global strategy. Now, as for the outcome, our outcome would be the improved access to screening, vaccines, and treatments for the cervical cancer in the Arab region. The major indicators for that, and of course, as you know, the monitoring framework is a live document, which means that it can be always enriched by additional indicators, and especially to also base that on the context of each of the countries. So the major indicators are the number of countries who have the national strategy for screening and treatment, percentage of the countries where the national policy framework includes the administration of HPV vaccines, number of countries in which 90% of girls are fully vaccinated, number of countries in which 70% of women are screened, and number of countries in which 90% of women receive treatment. The UNFPA and FOCP in this case will act as the umbrella to collect the data from the relevant organizations and country offices. And this can be conducted through the surveys as our verification means, surveys, reports of the country offices, and the data collected by FOCP from GCC countries. The major assumptions and risks that we face, as you know, the political unrest in the region, the political unrest, the government's willingness, and the availability of funds for this task. The second output is with regards to the partnerships and South-South cooperation, where capacities improved countries and organizations nationwide to control and monitor the cervical cancer. Well, the indicators are the number of cooperative efforts to enhance the South-South cooperation, number of countries with functional mechanism for implementation of global strategy, number of countries that have conducted the gap analysis and to determine the current needs, number of communication products, number of research and knowledge products focused on the implementation of the global strategy, and number of partners with key stakeholders. Again, the umbrella would be the FOCP and the UNFPA ASRO through the reports of the relative or relevant country offices. And we can see the risks and the assumptions. Of course, the COVID is a major challenge. And again, the availability of funds and security situation in our region. The third output it's about data utilization, where improved data analysis and utilization for evidence-based decision-making with regard to HPV vaccine and cervical cancer detection and treatment. The major indicators in here are the number of countries who established immunization registries, vaccine monitoring systems, number of countries who established patient referral and tracking system, and number of countries that produce relevant, timely data on the prevention and treatment of cervical cancer. Our last output would be the accountability for results through a robust monitoring framework for the progress of HPV vaccine. And the indicators for that would be the regional M&E framework is developed and agreed upon, which we are presenting currently. The second indicator would be the number of countries that established framework and tools to assess and evaluate progress towards cervical cancer elimination. A third indicator would be the number of actions that are progressing as planned in at least 90% of the countries in the region. These are mainly the outputs and the relevant indicators. I would stress the fact that this monitoring framework would need to be customized by each country to take into consideration its unique structural differences and level of readiness to implement this or to implement the Sharjah Declaration. And I would like to actually at this point hear initial remarks, especially with regards to the indicators, the frequency of the monitoring the indicators. And as I mentioned earlier, it is understood that the monitoring framework is a living document which should be enriched as we go, as we work. Thank you very much. I welcome any clarifications and feedback. Thank you.
إذا في أي أسئلة? Anybody would like to ask any question?
I have one question, Dr. Susan.
تفضلي دكتورة.
Thank you, Dr. Faraj, for this interesting presentation. In UAE, we have a good coverage of HPV vaccine among school-age children, females. And in Abu Dhabi, we are covering around 92 to 95%. Among Northern Emirates, it's around 82% since it's implemented in 2 years back. But our main challenge is in cervical screening. The uptake is very low, despite the big campaign for awareness and the facilities is available, the easy access to the facility, but still the uptake is very low. It was around 4% in 2018, and it's 8% in 2019, which was very low. And we need to achieve 70%. So we need to discuss the solution, how we can overcome this low uptake of screening.
I wonder to whom this question is addressed to.
You, Dr. Faraj. Since you presented the monitoring framework, so we need your access, your help in how to increase our uptake of screening.
Okay, maybe Dr. Shibel, you can help with that.
Yeah, sure. Thank you very much for the gifts, Dr. Faraj. Oh, thank you very much. I was planning to answer this question. That's why I've put my headset. So thank you very much for this excellent question. Actually, one of the objectives of this framework, or even the whole partnership between FOCP and UNFPA, is to identify the gaps and to learn from each other, from the region, through South-South collaboration, but also through a triangular cooperation to benefit from Northern countries' experiences. Now, the first part is I want to congratulate you for the HPV vaccine. 2 years ago, I was in UAE with my colleagues after the invitation that I got from FOCP during the first cervical cancer forum. And at that time, the HPV vaccination was at its early stages. It was mainly in Abu Dhabi, if I remember well. Now you say that you reached 92% in Abu Dhabi and 82 in UAE as a whole. So congratulations for this excellent achievement. Now, with regards to the screening or early detection program, I think, as I said before, the idea here is to learn from each other. Like the other countries should learn from you in terms of the HPV vaccination or immunization, I think that other countries are more advanced in terms of early detection of cervical cancer. Unfortunately, our colleague Youssef Shami is not with us today, but he could share the excellent experience of Morocco in terms of early detection. Even if the HPV vaccine is not yet introduced, they are planning to do so, but they have an excellent program in terms of early detection. When I presented the high incidence rate in Morocco of cervical cancer, is not only because cervical cancer is more prevalent in the country, but it's because they are able to detect the pre-cancer lesions, but also to detect the cancer at its early stages. So I think this is one part, is the South-South collaboration. The second part, I think, is the education. We need to invest more in education for the prevention, but also to invite people to do the screening, either through the pap smear or through the VIA inspection, but it is very important to educate people about the importance of doing the screening, is that, and also the fact that this cancer can be treated if detected at early stages. So I think those are the two pillars. The first one is at the programmatic level, is to learn from other countries how they introduced and they enhanced their program. And the second part is on awareness raising and education for the population. And of course, this means that the countries is ready and has the means to provide the early detection, and I'm sure that it's the case for UAE. Over to you. Thank you.
Thank you, Dr. Shabel. Thank you for your great answer.
I think also, Dr. Buthayna, what you have said is really a very good point. And, you know, a country like UAE, who is very well at everything is available when it comes to either the vaccination or the screening, and yet there is low uptake in the screening. I think these are the kind of data we are looking for to make sure that when we present in 2023 the outcome of such data, that then we can start talking about, okay, what kind of solution? And as Dr. Shabel said, it is learning from each other's experience as well. So I think this is great. I think somebody has also a question. I think there is somebody who had their hand. Dictora, I think.
Dr. Fatma.
Dr. Fatma, yes. If you want to ask.
Please.
Yeah. Hi, how are you, everybody? I hope you are doing well. Thank you for the great presentations. I don't know if you can hear me.
Yes.
Yes, we can hear you.
Yes. Perfect. So just to comment on the uptake of the cervical screening, I will share my experience in King Faisal Specialist Hospital in Riyadh. What we usually do, we remind the female with the recontracting. It's like, okay, you are due for your cervical screening. It comes with education, lots of education, either for yourself or your family or the female around you, either you are a male or female in the hospital. the cervical screening always, it comes up as an important prevention. Also, when we say we have campaigns, sometimes we have to really develop campaigns that target females. So we really need to validate the tools. It seems it's not working the way you do it, so you have to tweak it and see why you are not reaching the target audience. There is no impact, so there is something. And also the journey, the experience for the female from leaving her house, going to the hospital to do the pap test, it has to be something that's encouraging. So she will be your advocate. If she has a good journey, she will advise others to do it. So I think it's just a matter of communication and empowering patients. If women knows why she's doing it, I think she will help us in this process. And that's my 2 cents. Thank you, everybody.
Thank you, Dr. Fatma. Dr. Faraj, I have a question now. I'm sure lots of the civil society as well who are joining us, they are asking now that we have learned about the framework, we understand the objective, we understand the importance of it, we understand the endpoint, which is, of course, we understand the timeline when we need to report back, and we understand the endpoint, which is the forum in 2023. Now we want to personalize it, or we want to make it more into our region or our country. So how we can do that? Over to you, Dr. Faraj.
Thank you. Actually, it is suggested that we take, each of the countries would take this framework and then to customize it based on their reality, based on the context of the country, and most important of all, the availability of the data and the frequency of the availability of the data. So what we want to measure would be the same for the different countries across the region. So these are the indicators that we are going to measure. The countries are welcomed actually on 2 tracks. If you want to suggest maybe additional indicators also to include under each of these outputs, and to the customization mainly would take place on the availability of the data and the possibility to get the data from the national system. Obviously, as you and Dr. Shebel mentioned, we have different capacities for the different countries and different systems, and that would mean the availability of the data would be also different from each of the country contexts. So yes, the customization of the tool then would take place these principles. We are first of all measuring the same outputs. However, some additional or tweaking of the indicators can take place on the relevant. Over to you.
Thank you, Dr. Faraj. Would you like to, you have your hand raised, so please go ahead, the floor is yours.
Thank you. Dr. Sarah, part of the Messiah organization. I just wanted to share our experience of what has been happening in Sudan. When we first opened a screening clinic at one of the hospitals, Sobo University Teaching Hospital, we thought that the main issue was just raising awareness of females to get screened. So Messiah organization stepped in, and we did a lot of training workshops, TOTs, and then we did community advocacy, and we trained the religious leaders to spread the word and to increase the knowledge of females to be screened. But we realized that we had a mini survey, and we realized that despite the fact that we had increased their knowledge and we raised awareness, the utilization rate of the clinic was still low. And the number of females that was screened was still very low. So we had a mini survey, and we asked why aren't, despite of the fact that you had enough knowledge, why aren't you going to get screened? And we had very important things that came up. First of all, not many of them had that health-seeking behavior attitude, and they thought, why should we go and get screened since we don't have any symptoms? I wouldn't want to know anything before I get any symptoms. The other issue was their husband's influence, and this was a very important topic for us. Most of those females were under the influence of their husbands, and again, as a result, we started raising awareness of men as well, and we included in our training in the next coming sessions men, and this also improved the number of females that got screened. The other thing that came up was the procedure itself. Most females did not like the procedure. So we were talking to an organization in Sweden, and they were trying to help us to send the swabs for so that females can get self-tested. So these were things that came up in our mini survey, which really showed that it's not just for us, at least in Sudan, it's just not increasing their level and awareness on the importance of cervical cancer screening, but it's other issues which still prevent them from being from going to get tested or screened. Thank you. I just wanted to share our experience.
Thank you, Dr. Sarah. Dr. Leila, if you want to join.
Yes, thank you.
We cannot hear you very well, Dr. Leila.
Pardon?
Si tu peux te rapprocher du micro.
Bon, allô?
C'est bon, d'abord أحسن.
I'm Leila from Morocco, Dr. Sousan. I want to just talk about how we can push the government to introduce the vaccine. I talk about Morocco. I think we need more action, advocacy action, because we feel that sometimes the government is very engaged, and we feel the commitment about introduce the vaccine, and after we feel that the silence. I understand that this year we have the crisis COVID, but we need some advocacy, and I ask how we can together work in this area, because it's necessary to introduce the vaccine to eliminate the cancer. Thank you.
Thank you, Dr. Leila. I think these are exactly, I mean, your comment, your question, and question of and the comment of Dr. Sarah, and all of you, whatever you have said, these are the kind of data that we want to capture in the framework. Beside the actual figures, which Dr. Faraj has spoke about, these kind of gaps, these kind of need, these are very important for us. Because I know that, for example, from my personal experience, and Dr. Shibel can also, comment on that, that Morocco has a really great experience when it comes to awareness and advocacy as well. Of all the region, Morocco had maybe from an early start started working on the advocacy on cervical cancer. So these are the kind of, questions that we want. These are the kind of stories that we want to hear for us to be able to work on, maybe solution. Now we have the Support and Health of United Nations Population Fund, who actually can advise I'm not talking about on behalf of UNFPA, but again, they can also go and advise and give some suggestion on how to move forward on a country level. From us, also from FOCP, we work on civil society level. So if Dr. Shibel, you have any more comment on that front?
Yeah, thank you very much, Dr. Sawsan, and thank you, Dr. Leila, for raising this question. So I think you said it all, Dr. Sawsan. I want just like to add a few additional points. The first one, since the question was on the HPV vaccine, I think one of the things, because I know the context in Morocco, one of the gaps that we have is how to communicate better around the HPV vaccine. I think that the professionals, they are aware about the importance, but we need to communicate better for the decision makers, for those who approve the budgets, but also with the population, because HPV is linked with, let's say, sexual activity. So doing the HPV vaccine for students is not acceptable from cultural point of view, because we think that the vaccine has an immediate effect and it's about something that will happen during the adolescence. So we need to communicate better about the prevention role of the HPV for decision makers regarding the budget, but also with the population. The second thing is that, as I said before, we have to learn from each other. Sousan said Morocco has a good experience in some points, but other countries, they are more advanced in terms of the HPV vaccine. Namely UAE, we can have kind of South-South collaboration in this regard, but also other countries have a good experience. I remember that Libya was pioneer in introducing the HPV, even if the program was not implemented, but at least at the decision making, they were pioneer in taking decision to introduce the HPV vaccine. So we can learn from them as well on the advocacy that has been done on how they communicated around it and so on and so forth. But I'll be more happy to facilitate the process of linking the NGOs with the governments and with different countries to make sure that we can benefit from South-South collaboration. Over.
Thank you, Dr. Shibel. And to be honest, because I come and I voice civil society, it is very important for us, if anything, when we worked on the monitoring framework with the amazing team from UNFPA, from our point of view, from a civil society point of view, we really wanted this framework not just to be a tool to gather figures and data and best practices, but also it can be also an empowering tool for civil society to start engaging on a level with their respected government in their countries. So think about it from this point of view. So again, we just want things to be mobilized on the cervical cancer elimination. And we believe that this framework will be helpful. And you have our help, and I'm sure UNFPA team in each respected country office will be more than helpful as well, will be more than happy to help in any way and shape and form. And again, I'm not talking on their behalf. I'm sure Dr. Shibel will agree on that. Thank you.
Agreed, 100%, Dr. Sousan.
Thank you very much, Dr. Shibel. Anybody has any question?
Actually, I have a question. When it comes to exactly the issue you and Dr. Shibel mentioned about the partnerships and the South-South cooperation, how sorry, how would you perceive the cooperation between countries? Would there be an umbrella to boost the cooperation between the different countries, or it's completely left to the countries to decide on the cooperation between them?
You mean, Dr. Faraj, between countries or civil society and their
yeah, because when we say South-South cooperation, it can be between organizations in different countries. So how would that take place? Is it up to the organizations to decide on it alone, or there might be some guidance or umbrella to enhance or to boost this type of cooperation?
Dr. Shibel, if you allow me, maybe I can take that.
Please, please.
Thank you, Dr. Faraj. I think Dr. Shibel did mention before that he is happy to offer the introduction. I'll leave that to Dr. Shibel to comment on more. But what we can do from Friends of Cancer Patient is on the reporting month, we can also host a forum like this, a small place where each country can actually present their data and also have that discussion, because I felt that this is a great forum. I felt that because of the discussion that happened, this is like a first step. And as you know, always great things starts with good conversations. So I believe maybe in our next target is in November. That's where we said the first reporting should happen. And then in 2022, there's 2 milestones for reporting. So maybe in November, we can see a time like this, a 1 hour, where each country can actually, or civil society present what they have, because that's our reporting deadline for the first phase, but also provide some open forum for people and organization and entities to start speaking to each other. And please, Dr. Faraj, Dr. Shibel, or anybody, please jump in. Dr. Shibel, or to you, and I see Dr. Hadi wants to speak.
Yeah, thank you very much. Dr. Hadi, if you allow me, I will give you the floor right now, but just like very, very quickly to answer Dr. Faraj's query. I think the South-South collaboration is very important. It's even crucial. And as you said, this framework will help in doing that. How? First thing, I think it will allow us to know what's happening in the different countries, because we are not necessarily aware about what's being done or what has been done in all the countries. What we know is what was presented, either through official reports or through the different forums, including our regional cervical cancer forum. Now, the second thing is that this framework will also help us to identify the weaknesses and needs of the different, if we match the needs with what's existing in the different countries, so then we can identify how we can benefit one country from the other country through South-South collaboration. And what was suggested by Dr. Sousan is brilliant. I think it's very good to have on rotational basis, having one country or one NGO presenting what they are doing in terms of HPV vaccine and in terms of cervical cancer screening and treatment. Over to you, Dr. Hadi.
Thank you so much, and thank you for the invitations to such an important actually gathering and topic. And it's we really need to put more effort, as it's a cancer that we could take out. You know, we are having this opportunity that we could say we completely eliminate cancer. My question is more regarding toward the, here in Qatar, we have the HPV actually vaccination started during the COVID-19. It started in March during it's such a kind of a time that people were not expecting that. We've been advocating for it, and it happened in the mid of the pandemic in March of 2020. So regarding the data, the monitoring of the data, civil societies may not have access to the, I'm just talking in general here, that one of the challenges that come up to the mind of the civil society, having the access of the data, is it a bona fide data? Is it accredited data? What kind of, this is something that, and then sometimes you get into the challenge as civil society when you are asking government authorities or registry to have this data to get it to present it, then they for which purpose you're gonna use this data, and this is something, you know, I'm just saying what's inside, I mean, other people mind. So what's the kind of how we could help here as a group discussing this, the other civil society to get over this, because you know, I mean, we just it's important that we understand the politics. Politics is not only government politics, politics in everything. So I think that's something we need to discuss, actually, to have guideline how to overcome this challenge. Thank you so much.
Thank you, Dr. Hadi. Dr. Shibel, do you want to take this or me?
Up to you. So,
Okay,
okay.
I'll just start and give and hand over.
Please go ahead. Okay.
Okay, Dr. Hadi, thank you very much. And when you were talking, I was smiling. My face was like from ear to ear, because that's exactly what the things that we want to get out of these kind of conversation. And again, I did mention that a good thing would start with a very good, transparent conversation. So absolutely. And that is why now having this framework, it's a tool, guys. It's a tool for me to go to my government and say, you know, I'm part of this. I'm part of this regional framework. We have been chosen as a pilot organization, as a pilot entity. And you know what, even if they didn't get the figures, I don't care, but the conversation started. Where before a civil society or NGO maybe didn't have that relationship with the policymaker before in that country. That's exactly what I was saying when talking about using the framework as an empowering tool, not just data gathering or best practices or gap analysis or need analysis, but also the empowering tool is that, okay, I have been doing this for a very long time. I have been doing it in silo, maybe from my policymaker in the country. Now this is a great opportunity for me to go and knock on their door and say, I have been chosen to do this. And by the way, even on a national level, policymakers are involved in this. I am doing this. How can I support, or how can you support me? So I think these are the kind of, you know, first step that we need to take. Maybe you have something to add, Dr. Shibel, over to you.
Yeah, thank you, Dr. Sassan, and thank you, Dr. Hadi, for raising this issue, which is obvious that, I mean, there are challenges in terms of data, not only with regards to cervical cancer, but data in general. Data is politics, and politics needs data. But I think that what we expect from different partners in terms of collecting data is first, not the national data, but first on what has been done by the organization itself, and what kind of advocacy was done, and what kind of challenges and gaps were identified. So this kind of data, I think it's not really politicized. It's something that you can provide, and that can help us. And I think the rest was already said by Dr. Sausan. Now I want just like, since we are talking about data in the framework, maybe it's it wasn't clear how this will be collected. So we have different channels. To get the official data, of course, we can go it through different channels, and we can communicate with ministries of health and so on. The second thing is that we say that for the GCC countries, FOCP has a good network in the GCC countries, so FOCP will be playing the role of gathering data from the different GCC countries. In the other countries, UNFPA has a presence through country offices. Of course, we have an office in Oman. It's very active office, a GCC office, but we have an office in each of the other Arab countries, and we will be gathering data through these country offices. So they will work with the civil society, but also with the governments, and they can share with us the data needed. Over.
Thank you so much.
I don't know if there are other questions
yeah.
from colleagues or need for clarification. Please, colleagues, don't be shy. I assume that we will be one family for the rest of our life. So don't be shy and share with us whatever concerns or questions you have. So this is just like the kickoff, but we will work together, inshallah, for the coming years very, very closely. Okay, I think we are done. So I will give the floor maybe to Dr. Sausan for the closure.
Thank
or
you,
any
Dr.
additional
Shibel.
comments. Over to you.
Thank you, Dr. Shibel. Thank you, everybody. It has been an honor and a pleasure to spend the last hour with you. We will be communicating with all of you, inshallah, through an email. I know that all of you have shared with Majid. Thank you for sharing your name and mobile number. We are going to create a WhatsApp group as well. So that's easy for us to communicate with each other. We will let you know about the November presentation, which is the first milestone for us. And we will definitely be in touch. Please feel free to contact us again if you need anything in between. And I wish you all the best with the framework. Thank you very much.
Thank you, colleagues. Thank you very much. And thank you, Dr. Sausan and Majid, for this excellent webinar. Thank you.
Thank you.
Thank you,
Thank
Dr.
you.
مع السلامة.
Thank you. مع السلامة.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you from Sudan.